I'm very pleased to have been invited to talk today at this important seminar to commemorate almost 20 years since the publication of Birth to Three Matters. And in asking the question, does Birth to Three Matters still matter? I want to focus on how numbers can tell us a mixed story. For the last 25 years or so, I spent most of my time working predominantly as a researcher who focused on qualitative approaches. So I quite surprised myself when I decided that today I would focus on numbers. My first numbers are important dates which connect some of the pioneers of the rights of infants. I wonder if you recognise any of them. The story begins in Manchester in the mid-1800s, when Solomon Schwabe set up a calico printing factory and provided schooling for his workers. This experience led Solomon's wife Julia Salis Schwabe to pioneer teacher education for women by establishing in England in 1892 the Froebel Educational Institute for the education and training of kindergarten teachers. Julia was inspired by the German educationalist Friedrich Froebel, who invented the concept and the word kindergarten 180 years ago this year. It was Froebel's philosophy of holistic early childhood education and care, centred around play, self-activity and real-life hands-on learning experiences, which Julia brought to England. In about 1805, the influential Swiss educator Johann Pestalozzi relocated his own early childhood institute to Yverdon in Switzerland, and it was here that Friedrich Froebel spent 2 years training from 1808 to 1810. But Froebel wasn't the only pioneer to spend time with Pestalozzi at Yverdon. After time managing a mill in Manchester in his early 20s, Robert Owen moved to New Lanark in Scotland, and it was there that he set up his experiment in social justice. His Institute for the Formation of Character opened on New Year's Day 1816, and 2 years later he too travelled to Switzerland to meet Pestalozzi, and he was influenced by the kindness and common sense of Pestalozzi's approach to teaching young children. But it was a contemporary of Robert Owen, Thomas Spence, who first articulated the rights of infants in a pamphlet he published in 1796. Growing up in Newcastle upon Tyne in the second half of the 18th century, Spence was appalled by the inequalities in society and the treatment of babies and children. Undoubtedly, he was influenced by what he saw in some of the cotton mills he visited in northern England. Which brings us back to Manchester. My next two numbers are 1.5 million and 1846. It was the year 1846 in which Solomon Schwabe used 1.5 million bricks to build his 358 feet high calico printing factory Chimney. It cost him £5,000 and was the tallest chimney in the industrial north in its time. This is a photo of that chimney from across Heaton Park, and I happen to know that two contemporary pioneers of the rights of infants to high-quality early childhood education and care have a close connection with Heaton Hall and may well have looked across this Heaton Park view. They are, of course, Professor Leslie Abbott on the right, who led the Birth to Three Matters project with her team in 2001, working hard to produce the framework for effective practice. And on the left, Professor Tricia David, who led the review of literature that was published to underpin the framework. Both of them hail from Manchester, and so I'm claiming for them 6 degrees of separation with these other pioneers of the rights of infants. The question that we were asked to address first in today's seminar is, to what extent have social and cultural changes impacted the needs of our youngest children? And I find this question really difficult to answer for a number of reasons. When we talk about extent, we're really trying to understand change and measurement, and there are gaps in data that make this very hard to assess. When we talk about social and cultural changes, clearly those are many and diverse, and not just in the last 200 years, but indeed in the last 20 years, we've seen significant changes in our society. But nevertheless, I think that the rights that Tom Spence talked about in 1796 still apply today, where we see that young children are undoubtedly not free from abuse or poverty. I just want to remind you of some of the things that Tom Spence talked about in 1796 in his pamphlet, when he wrote from the point of view of a woman and said, "Shall we be asked what the rights of infants are, as if they had no rights? As if they had not a right to the milk of our breasts, nor we a right to any food to make milk of? As if they had not a right to good nursing, to cleanliness, to comfortable clothing and lodging? I see no reason why those rights shouldn't be applied today if we want to talk in a discourse of rights, whereas some will want to talk about the discourse of needs, both of which are contentious, of course." And so I want to think about the situation in 2020 with regard to Tom Spence's call for children to be free from poverty. The just published Michael Marmot review 10 years on from his original publication tells us a lot about what's happening for young children in this country in 2020, and we can see that although there has been some progress in relation to young children's health and development, we have in some respects gone backwards in the last 10 years with higher child poverty rates and children who are hungry, with cuts to Sure Start centres and children's centres and other children's services. And we know that the gap for the richest and the poorest children is growing. Figures from the Children's Society tell us that around 4 million children in Britain are currently living in poverty. And the Trussell Trust, which supplies around 2/3 of the country's food banks, reports that in the year to March 2019, about 500,000 children up to the age of 15 were living in poverty. So 20 years ago, when the Birth to Three Matters framework was published, evidence at that time was pointing to the ill effects of poverty, and in particular relating to food hunger, to malnutrition in young children, and the difficulties that those children were experiencing at the time, but also to the longer term problems that they would experience as a consequence of poor nutrition and malnutrition. And so when we look at international comparisons, we hear from UNICEF that out of 41 rich countries, the UK comes in 34th place in terms of its provision for adequate nutrition for all young children. The organisation UKSSD holds the government to account in relation to its performance against the Sustainable Development Goals. And we can see in its latest assessment from 2018 that the UK is performing very poorly in relation to Target 2.1 and 2.2, both of which relate to ending hunger and malnutrition among infants and very young children. But here we can see the second part of the story as well, which is concerned with the lack of appropriate data. So, for example, in the slide that referred to the Trussell Trust, I mentioned that around 500,000 children had accessed their food banks. The problem is that the data refers to all children from birth to the age of 15, and we simply don't know how many of those children were aged from birth to 3. We don't know how many babies, toddlers and 2-year-olds are living with food hunger and in poverty. What we do know is that babies can sometimes be significantly more vulnerable to abuse than older children, which of course takes us back to the second point that Tom Spence made in his Rights of Infants, the right of babies to be free from abuse and harm. In their publication in 2011, All Babies Count, the NSPCC highlighted some of these vulnerabilities which are disproportionate for the babies up to the age of 1. Nevertheless, in 2018, we still saw the Children's Commissioner calling for better data in relation to babies and toddlers and very young children, and saying that actually we have quite extensive knowledge gaps in relation to children who are homeless or living in insecure housing, those who don't meet the threshold for the intervention of social workers, prisoners' children, babies who are living in the so-called Troubled Families programme, children whose parents have problems with substance misuse, households with domestic violence, and children whose families experience mental ill health. Of course, data isn't the answer, and there are many other ways in which we need to think about these problems, but having a lack of data does make it all the more difficult for us to call to account the government to make better provision for these very young children. The Department for Education began collecting data from surveys of providers of childcare and early years education in 1998, and the survey was repeated roughly every 2 years up until 2003, and then annually from 2005 to 2011, and then again in 2013 and 2016. And subsequently, the survey was made annual again from 2018. When we look at the findings from the survey of providers from 2009 and 2013, one thing that's notable is that babies and toddlers are grouped together under 2-year-olds. And so actually it's very difficult for us to determine how many babies up to the age of 1 were in formal group-based childcare provision and how many 1 to 2-year-olds. This is once again part of the story of missing data. The 2019 main tables from the survey of providers doesn't refer to children's ages at all in all 24 of the tables that have been produced and made public. So instead, to try to ascertain the numbers of babies and toddlers who might be experiencing early childhood education and care group-based provision, we need to look instead to the survey of parents, which is conducted also by the Department for Education. And in that, in the 2019 report, we can see that the data on this occasion are separated by age annually. And so, for example, we can see that in the year 2018, the parents involved in the survey reported that 32% of them were using any kind of childcare for babies up to the age of 1, and 62% for babies aged from 1 to 2. And of those, 11% were accessing formal provision rather than, say, care by grandparents or other family members, and 36% were accessing formal provision for 1 to 2-year-olds. The percentages of babies and toddlers in formal group-based early childhood education and care provision is interesting in its own right. But actually, when the data are coupled with other findings from other research, they begin to tell yet another story. And so in recent research, again commissioned by the Department for Education as a follow-up to the early years survey of parents in 2018. The department asked parents who were not currently using formal childcare for their babies or toddlers and who were not on parental leave if they would be inclined to use formal childcare if access to 15 hours of funded provision was made available to them. And of those parents who were asked, 78% said they were either very likely or fairly likely to take up such an offer if it was made to them. This finding suggests at least two things, really. For example, that either the cost is prohibitive for far too many parents who might otherwise choose to access formal provision for their baby or toddler, and secondly, that perhaps there simply isn't provision available in an area that is accessible to those parents. We've had numerous reports in recent years that have looked at whether early childhood education and care is affordable for all families, and most of those reports have highlighted the inaffordability for many families in the UK. But also we have data that tell us about sufficiency of provision, and when we look at those figures for children up to the age of 2, it's quite clear that local authorities who reported their findings to the Quorum Family and Childcare Survey stated that there was insufficient provision across their areas for such young babies and toddlers. And so if the government were to make an offer of 15 hours per week of funded early childhood provision for those parents I mentioned previously, then we have to ask ourselves, where would that provision be located? The question also arises as to babies' rights, indeed all young children's right, to high quality early childhood education and care provision. But also conversely, for those families who might be struggling as a result of not being able to go out to work, but may actually want to keep their babies at home with them, we might also think about babies' rights to be at home with their families, and in circumstances in which they're not finding themselves in poverty or food hunger. Aside from the human story, of course, there is a numerical story related to this offer, or potential offer, of funded provision for babies and toddlers. If 78% of all parents with babies and toddlers were offered and took up 15 hours a week of funded early childhood education in formal settings, what would this look like and what kind of investment could be expected? The Office for National Statistics reported the numbers of live births in 2017 and 2018 in England. The 2018 survey of parents' uses of childcare told us that 11% of babies up to 1 and 37% of toddlers from 1 to 2 were enrolled in formal group-based early childhood provision. We can work out what numbers 11% and 37% represent. Having done that, we can subtract those numbers from the total live births for these age groups to find out the numbers of babies and toddlers who were not enrolled in early childhood group-based provision. A further calculation indicates that 78% of those who were not enrolled equates to 434,000 babies and 317,000 toddlers, making a total of roughly 750,000 young children who might access funded hours if the offer was made to their parents. We can then use this number of 752,000 babies and toddlers to work out what the investment would need to be per week of funded hours. Blaney and Paul reported in 2017 that the average hourly cost of delivery for children up to the age of 2 was £4.58. So for 15 hours, this equates to nearly £52 million per week if universal entitlement was made for all those parents who said they wanted it for their 752,000 babies and toddlers. One of the benefits, perhaps, of the provision of funded early childhood education and care for babies and toddlers by the government is that the data will undoubtedly be collected in those circumstances on the numbers of children accessing such provision. And so we might begin to see a different kind of story, a longitudinal one. In New Zealand, in 2019, the editors of the journal The First Years, which is the New Zealand Journal of Infant and Toddler Education, celebrated their 20th anniversary year. And Maria Cooper and Marek Tezar wrote in their editorial the following. In the year 2000, children up to 2 made up 32% of all enrolments in licensed early childhood services in New Zealand, and by 2018 this number had grown to 40%. That kind of simple statement about changing percentages is something that it would be so much more difficult to write in comparable circumstances in the UK due to the lack of data that we can access. So that in itself, that data in New Zealand is memorable and notable, but perhaps it's also memorable and notable to pay tribute to the fact that New Zealand has for 20 years had a journal that is devoted specifically to infant and toddler education. And perhaps it's also a sign that internationally the visibility of infants and toddlers in discourses of early childhood education has been growing. It goes without saying that babies and toddlers are frequently referenced in the Birth to 3 Matters framework, and it's good that these references to babies were carried through into the early years foundation stage statutory document. They were also carried through into development matters, where perhaps we can see more evidence of Birth to 3 Matters, certainly in the 2012 edition. It remains to be seen what the latest version will contain. And similarly, reference to babies is made in the Early Years Inspection Handbook from Ofsted in the 2019 version, and the recently published 2020 Realising the Ambition document to support practitioners in the early years in Scotland has a substantial number of references to babies and to toddlers as well. Nevertheless, the references to toddlers are far fewer than those to babies, and perhaps this is something that we need to keep an eye on as time goes by. The numbers on this slide are illustrative. They're intended to show the growth in scholarship about infants and toddlers in the period from 1990 to 2020. The first 10-year tranche reflects a time when the team that I was involved in for the literature review for the Birth to 3 Matters project would have been searching for relevant articles, books and chapters that would be included in that literature review. The second period, the next 10 years, is immediately following the commissioning of the Birth to 3 Matters project, of course, and then the most recent 10 years in which we can see a huge increase in the number of articles that are yielded through this sample search for toddlers and early childhood pedagogy in the database of electronic journal articles. I think this is noteworthy and something to celebrate. And I think it's fair to say too that the publication of Birth to 3 Matters drew international attention, and in fact it was only last year that I discovered that it had been cited in a Mexican document concerning infants and toddlers produced by the Mexican government. It's important, of course, that there isn't a separation between research and practice, and indeed many practitioners are themselves researchers. But sometimes there is a divide, a gulf between those engaged in infant and toddler research and scholarship and those involved in the education and care of babies and toddlers. In the Baby Room project that Kathy Gooch and I worked on for about 10 years, we asked the practitioners who were involved in our projects what had influenced and inspired their work, and research didn't feature in any of their answers. This is very worrying, and I think what it indicates is that we've got to work a lot harder as researchers to make sure that our work is accessible and translatable, usable and useful, and also is close to practice in that it addresses the kinds of issues that those working with very young children are dealing with and interested in. This is where a journal like the New Zealand journal that I mentioned is incredibly important, because it brings together research and practice articles. But also, I think it's worth mentioning the great job that Nursery World and other publications do in trying to bring the findings of recent research to the attention of those working with young children and their families. And also, of course, days like today's seminar are hugely important in bringing together in conversation all those with an interest in birth to 3 matters. We've just celebrated 30 years of the UN Convention on the Rights of the Child. In General Comment 7, which the UN published in 2006, to refer specifically to the implementation of child rights in early childhood, there's a requirement that all staff have age-appropriate training for their work. I think it's fair to say that for many years there has been a lack of training that is devoted particularly to those who work with babies and toddlers. But I am delighted that over the last few years, baby room projects have sprung up all over the country in a number of local authorities, but also in settings. We have consultants who offer excellent specialist training for those who are working with babies and toddlers. Today's event is a great example of the interest in birth to 3 matters. We also have the Association for Infant Mental Health, which arranges an annual conference, and the 1001 Critical Days campaign and project, which is now a charity in its own right, is also starting to be very influential again. But I'd argue that there is still room for more local and national groups to arrange opportunities for dialogue and debate and mutual support to consider the matters important to the age group from birth to 3. I want to finish on a celebratory note. In 2015, the Economic and Social Research Council marked its 50th anniversary by celebrating 50 pieces of research that had provided insight into the social sciences. One of those projects that was mentioned was Birth to 3 Matters. So not only has it been significant to those of us with a particular interest in infants, toddlers and 2-year-olds, but also it's sufficiently noteworthy to have made it into this top 50 of research achievements celebrated by the ESRC. And I think I want to pay respect to Leslie for her insight and expertise and wisdom, and her collegiality that led to the success of this particularly important project that we're celebrating today. Friedrich Froebel not only believed that babies were competent learners from birth, as well as being social agents, but also that they deserved high-quality care and education through nurturing relationships. The Froebel Trust takes a principled approach to supporting research and practice in early childhood education and care. You can find resources on our website. You can apply for grants. Please follow us on Twitter or look us up on Facebook.